In the 2020 Cheez It Bowl against Oklahoma State, Miami Hurricanes quarterback D'Eriq King went down with a right knee injury. On the actual play that King hurt his knee, he was the ball carrier and was hit by a defender. Right after he was hit, we saw him clutch that right knee before he was eventually helped up by medical staff, and he limped off the field with assistance. Now, sources are already reporting that King has in fact a torn ACL in that right knee, and he's going to have surgery next week. Despite this, however, the Miami Hurricanes are already saying that they are fully confident that he'll be back in time for fall camp in 2021. Now, fall camp typically starts in August. Is this too early? Will he be available in time? Welcome, college football fans. For those of you that aren't familiar with my channel, my name is Nick Gallo, and I am a doctor of physical therapy. With today's video, I'm going to take a close look at that right ACL injury that D'Eriq King suffered in the 2020 Cheez It Bowl. First, I'm going to start off today's video by showing the actual play that King was injured on so that we get a good visualization for that mechanism of injury. Then I want to go over the specific anatomy associated with that ACL tear. And finally, I want to go over a typical time frame for an average person that's coming back from ACL reconstruction. And I want to talk about whether or not I feel like the 8-month time frame is reasonable. If you like today's video, please hit that thumbs up and subscribe to the channel because I will be making more videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the section below. Now to begin, let's take a look at that play that King was injured on.
Here we see as King rolls out to the right. He is a ball carrier and he's going to be hit by a defender. After the hit, we see him clutch his right knee and he is in obvious pain. The medical staff comes on the field and immediately starts to evaluate King's right knee. He is then helped up and walks off with assistance. We can see here on the slow motion play that right knee buckles in before he's hit. Now there was a question whether or not the hit or the cut made him injure his ACL. Because the ACL provides an overall rotational stability in the knee, I believe right here when that knee dives in, that's when he injured it.
Now here I have an anatomical model of the knee. I'm going to go ahead and remove the patella so that we can see those deep structures of the knee joint. Now it's important to note for overall knee stabilization, there are 4 ligaments that play major roles in this. The first one is of course the anterior cruciate ligament, or the ACL for short. Then we have the posterior cruciate ligament, or the PCL for short. Then we have the medial collateral ligament, or the MCL for short. And finally, we have the lateral collateral ligament, or the LCL for short. Now here on the model, we see that the ACL is located deep in the knee right there. The PCL is located on the back of the knee, also deep. Now we also have the LCL, which is located on the side, lateral meaning side. And finally, the MCL is located medially, meaning that it's towards the inside or towards the midline of the body. There are also 2 other very important structures within the knee, and they are the medial and the lateral meniscus. You can think of these 2 things as shock absorbers. They prevent the femur and the tibia from grinding bone on bone. In King's case, we know that it has been reported that only the ACL has been affected, which is a positive because sometimes these types of knee injuries can cause multiple structures to be affected. In 2018, he actually suffered a torn meniscus in the same knee, but this time it doesn't appear that it has been affected. Now we can see here on this model that the ACL runs from the femur to the tibia, and its main function is it's going to prevent that anterior or front movement of the tibia away from the femur. The ACL also functions to provide a very important rotational stability at the knee joint. So when we saw King plant awkwardly and we saw his knee cave in like this, I believe this is most likely the moment that he hurt his ACL. Now King will be having a full ACL reconstruction, which essentially what they're going to do is they're going to take tissue from either somewhere on King's body and create a new ACL, or they will take one from a donor and use that to create a new ACL. Now we don't know exactly the type of reconstruction that King is going to be having. However, in cases such as this, when the ACL is torn, most likely they will be doing that full reconstruction. Now let's talk about time frame for returning to sports. Typically, in the average person, anywhere between 6 to 6+ months is about the time frame that a person can start to return unrestricted to sports. This is of course dependent on several things and really dependent on how the person does in the rehab process. Now many things are working in King's favor for the rehab from this injury. The first being the fact that he was in great shape before. He's a college athlete, and this absolutely is in the positive for him. Also the fact that King is fairly young. This, as far as I know, is the first ACL tear that he's had in that knee. And finally, at University of Miami, he's going to get probably the best rehabilitation possible. The fact that the Hurricanes are already projecting that he's going to be back in about the 8-month mark, I think is very possible for him. Now, whether or not King will be 100% back to prior form at this time frame, that's going to depend on whether or not there are any other complications with the knee and of course how he does with the whole rehab process. Therefore, I do think that the 8-month time frame is reasonable, and I think it is possible, but we will have to monitor his case and see how he does overall from now until then. And that's it regarding D'Eriq King's ACL tear during the 2020 Cheez It Bowl. Once again, if you liked today's video, please subscribe to the channel because I will be making more videos in the future. Thank you for tuning in, and I'll see you next time.